Fertility rates in the United States are near historic lows. One reason is a sharp decline over the last 3 decades in the number of American women having babies in their 20s. And yet, there's been no change in women's biology or the age at which fertility declines. Unsolvable problem? Enter egg freezing. Freezing embryos for in vitro fertilization, IVF, has been possible for decades. But freezing unfertilized eggs was a tougher scientific challenge, used initially for patients with cancer and other conditions that threatened fertility. Egg freezing for non-medical reasons became an accepted practice 12 years ago. And since then, demand has skyrocketed, with hundreds of thousands of eggs now frozen, raising big money, big hopes, and big questions. Could egg freezing offer women what previous generations only dreamed of? The chance to put that dreaded ticking of the biological clock on ice. Early one rainy Tuesday, Kate Sonderegger came to a fertility clinic in Midtown Manhattan to undergo a minor surgical procedure to harvest and then freeze her eggs. Lie down with your head here. The next morning, Hi. At a different fertility center, we scrubbed up and met another egg freezing patient, Catherine Schneider. How are you feeling?
Excited.
Her doctor, Tomer Singer, head of Northwell Health's fertility practice, escorted her into the OR.
Let's get some eggs.
Let's go. Let's get some eggs.
Egg retrieval is the culmination of an arduous process. Nearly 2 weeks of daily self-administered hormone injections, sometimes several a day. The shots induce the ovaries to ripen multiple follicles, the sacs that contain eggs, so that a surgeon can go in with a tiny needle.
You can see the white end of the needle.
And drain the fluid in those follicles, which is then run into an adjacent embryology lab to search for the eggs. So the patient is right around the corner.
Correct.
We watched as a pair of embryologists did the delicate work of maneuvering tiny pipettes under a microscope to find and isolate Catherine's egg cells in the fluid.
And here are all the eggs together. See? 1, 2, 3, 4, 5, 6, 7.
Black
Yes.
balls are.
Yeah.
Those are the eggs.
Those are the eggs.
Oh my goodness. After a few hours, the eggs are put onto tiny special straws, then plunged into liquid nitrogen and stored in tanks at negative 320 degrees, where they will stay, possibly for years, until their owner is ready to thaw them, add sperm,
And after we inject the sperm, it fertilizes.
and turn them into embryos, which is effectively the second half of IVF. According to the data thus far, as with IVF, there are no differences in the health of babies born from frozen eggs.
I think that egg freezing is as revolutionary as the pill was in 1960s and 70s.
It's as revolutionary as the pill?
Yeah,
And that changed everything, as you know.
I know. Women had the option of choosing who to be with and not to accidentally get pregnant with the wrong guy. And egg freezing took it an extra level. So you don't have to have a baby at 30 because you're 30 or 35. You can delay fertility into your 40s. You'll have women having kids in their late 40s with their own eggs that were freezing in their 20s and 30s.
There's a famous painting of the young woman with tears going down her face. Oops, I forgot to have a baby. That won't be true anymore.
Correct. I think that we're pushing the envelope.
I'm currently 40. I froze my eggs when I was 35.
The first time I did it, I was 34 years old, and the second time, I was 36.
I did 2 cycles last year when I was 34.
We spoke to a group of women about their decision to freeze their eggs. Why is it a good idea?
I 100% know that I really would love to have children.
Yasmin Higbee is 29, works in consulting, and has a serious boyfriend.
I'll be able to enjoy these times with my partner a bit more instead of rushing to have kids, because there definitely is that tick-tock clock that started. and I'm not ready quite yet.
It's an insurance. I know that, I'm going to be an older mother.
Namitha Jacob, 38, a healthcare administrator and strategist, isn't ready yet because she hasn't found the right partner.
It takes the stress away from dating. You're not pressured to find someone and settle down and get married. You don't hear the ticking.
That damn biological clock. It ticks in every woman's head.
Amazing.
Like it or not, says Dr. Lucky Seacon of Fertility Clinic RMA of New York, that damn clock is very real.
We're born with all of the eggs that we're ever going to have, and we don't make new eggs, and we can't fix or repair them. It's always decreasing over time.
So you're born with a number.
Yes.
And it starts decreasing right away?
It pretty much starts decreasing even before you're born. You're a fetus in your mother's womb at 20 weeks, and that's when you have the peak number of eggs, 6 to 7 million.
You have eggs at 20 weeks?
Yes.
And from then on, the number keeps going down, and the eggs keep aging. So when you freeze an egg, you are stopping it from aging any further.
Correct.
So if you remove the egg and freeze it when you're 28,
right?
That egg is 28 years old.
Yep.
Until you thaw it.
Yes, it's incredible.
Because it's not just the quantity of women's eggs that decreases with age, it's also their quality, meaning their likelihood of becoming a baby. Even at peak fertility in women's 20s, some 25% of eggs, when combined with sperm, will create embryos that are chromosomally abnormal and will likely lead to miscarriages, and the percentages rise from there.
As you get to 35, that number has steadily increased to about 30 to 35% of embryos being abnormal from your 35-year-old eggs. At 37, 38 years of age, 50%.
Ooh.
That's a turning point. Things start to move more rapidly. And at 40, you're looking at 60 to 70% of embryos being abnormal. By 45, 90%.
90%?
Correct. A lot of times people think that if they've done all the right things, if they've led a healthy lifestyle, they do yoga, they've never smoked a cigarette in their lives, they feel younger than their age, and they feel like their eggs will be younger than their age. And I have to explain to them that we have no data to suggest that you can influence your egg quality in that way, unfortunately.
Is there an optimal age to freeze your eggs?
Yes, your 20s, because that's when you're at your lowest possible rate of genetic errors in the embryos that result from those eggs. And you also have a lot more eggs at that age. Okay.
Kate decided to freeze her eggs at the unusually young age of 22 because she's going to medical school and knows she has a long journey ahead of her.
Education for 4 years, training for anywhere from 4 to 7 years after that. And so I'm not even going to think about building a family personally until after I'm done with all of that.
Younger and younger women are beginning to freeze their eggs.
When I started doing egg freezing in 2012, most of the women were 40, 41, 42. When I see patients today, most of them are late 20s, early 30s.
He says there used to be a stigma, as though freezing eggs meant something hadn't worked out in a patient's life, but not anymore.
It became a common thing. It's almost empowering. You come in, I'm in my 30s, I'm not ready for a baby, I want to freeze my eggs, I'm not going to compromise on the wrong guy.
Freezing eggs is expensive. A single cycle, including medication, costs an average of $12,000 to $15,000, plus another $500 to $1,000 each year for storage. To thaw and fertilize the eggs later on costs an additional $10,000. Back in 2014, Apple and Facebook made headlines when they started offering egg freezing as a covered benefit for their employees. Today, more than a third of the largest corporations in the U.S., those with 20,000 or more employees, cover egg freezing. Our parent company, Paramount, among them.
When I was job searching, it was something I was really looking for. From a
Carissa Simic changed jobs 3 years ago.
More and more companies started to offer it, or I was seeing it.
So that was a consideration
Absolutely.
as to where you worked?
Yes, absolutely.
Her egg freezing cycles were covered, as were Namitha's, but there's also been criticism of those companies' motives. There are some people who feel that the companies do that to keep you at work so that you won't have a child and leave, not to make you happy, but to keep you at your desk.
I personally don't see it that way. When I learned about the fact that they're offering this really wonderful benefit, it made me more dedicated and committed to my company, actually. It's a good way to retain top talent.
My insurance did not cover egg freezing at the time.
Tina Rampino, now 46, learned about egg freezing in its early days when she went for a routine doctor's visit at age 35 and got a message she wasn't expecting.
My gynecologist said to me, have kids now. You're running out of time. You can get married whenever you want to get married, but you can't have kids forever.
Whoa.
And I went home and I think I cried. And I was like, what should I do?
The doctor had mentioned egg freezing.
And I said, this is kind of scary, but I decided to do it.
Paying out of pocket, she froze 10 eggs, which she considered her backup plan.
I did not have a partner.
Lindsay Smithson Stanley also paid out of pocket when she froze her eggs at 35. A few years later, she got engaged to Paul. They want children, but not until they're married and Lindsay finishes her PhD.
There's a very good chance that we'll get another youth.
So Dr. Singer recommended thawing her 18 frozen eggs, fertilizing them with Paul's sperm, and then doing genetic testing to assess viability.
And that's a day 5 hatching.
Which is possible once fertilized eggs grow into 5 to 7 day old embryos. The results? Lindsay and Paul have 4 chromosomally normal embryos on ice waiting for them. Do they tell you the gender?
We have 2 boys and 2 girls.
You can't stop grinning.
It's exciting.
Tina's story took a different turn. After the pandemic, still single, she decided to become a single mother by choice and selected a sperm donor.
I had just turned 40, and I knew that motherhood was something that I always wanted. Sorry, I'm like...
But the first embryo created from her frozen eggs failed to implant. But then...
Where's Christopher? There's Christopher.
A second embryo from her frozen eggs did. She gave birth to a son, Christopher.
He's such a happy, healthy boy. He's so playful. He loves people. On the day that I started my egg freezing cycle, I screenshotted a quote that said, "Do something today that your future self will thank you for."
Oh.
And that is something that I think about all the time because that really was the decision that changed my life.
But not every egg freezing story has such a happy ending.
It was just devastating. It's really the worst thing that's ever happened to me, by far.
They think they have an insurance policy that they don't have.
Does egg freezing promise young women more than it can deliver? When we come back. More and more American women are freezing their eggs to preserve their fertility. The number of procedures has increased more than 6 times over, from 6,000 in 2014 to more than 39,000 in 2023, with numbers continuing to go up from there. Investors have taken notice, seeing a market that could one day include a significant percentage of all young American women. Venture capital and private equity firms have backed egg-freezing startups and have bought up and invested in existing private and academic fertility clinics to consolidate them into giant networks. But not everyone is convinced that egg freezing is such a gift to young women.
You're taking the financial cost, you're taking the medical cost, for what? For a gamble.
Vardit Ravitsky is president of the Hastings Center, a bioethics research institute, and is a senior lecturer at Harvard Medical School.
The women we've spoken to, they're almost giddy with this choice. They say that they're freezing the biological clock. That ticking thing is, unbearable, and it's gone.
I totally understand why young women are excited about it. My fear when I hear young women say, I froze the biological clock, is that they think this is guaranteed. They think I put a baby on ice, not my eggs, and I'm just going to go and thaw it when I'm ready to become a mother. It's not that. That's the problem.
She points to stories like Evelyn Gosnell's. Evelyn froze her eggs 3 times at ages 32, 36, and 38 for a total of 30 eggs, considered a very safe number.
Did you have some level of comfort?
Absolutely. Even my doctor was like, that's insane. Like, this is going to be a breeze. Totally. No problem.
But when Evelyn and her now fiancé Edward went to use her 30 frozen eggs, only 19 survived the thaw, an unusually poor result. Even worse, once those 19 eggs were fertilized, only 1 grew to be an embryo. Anxiously hoping for positive results, they sent a few cells off for genetic testing to see if the embryo was viable.
So I was at work and got this message saying, we have your test results. Before we give them to you, just confirming if you want to know the sex.
Boy, girl.
I just started to think, oh, wow, they've asked me this, if I want to know the sex. It means that there's a real embryo there. It means that this is real, it's normal, it's going to be fine, it's all going to be good. And then, boom, I get the report, and I open it, and it's abnormal, and it was a girl.
There was no chance the embryo could become a baby. Stories like Evelyn's are heartbreaking. And though rare, there have also been incidents where a storage tank has malfunctioned and thousands of eggs and embryos have been destroyed. Dr. Lucky Seacon says she explains to all her patients that frozen eggs can never be a guarantee, because just as in naturally occurring pregnancies, there is drop-off at every step along the way. She calls it an inverted pyramid.
Like you start out with this many eggs, and then this many fertilize, this many turn into embryos, this many embryos are actually genetically healthy, and this many embryos actually implant.
You're taking a bet. It's a gamble that you'll actually need these eggs. It's a gamble that it would work. And even if you manage to get pregnant, the older you are, the riskier it is to be pregnant. So you're taking multiple risks. You're gambling on multiple stages.
But are you saying don't do it?
You know, Lesley, I'm not saying don't do it. I'm saying it's probably a good option for some people, but I would like young women to really have options.
She believes that society pushes high-achieving women to get so much accomplished before they have children that they run out of time, and it would be better if they could become mothers younger.
The optimal time from a biological medical perspective is in your 20s or early 30s, but the socially optimal time is later than that. So I think we're telling women, oh, in your 20s, focus on your education, your career, finding a partner, having financial stability, relationship stability, so that when you do have a baby, you can be a responsible mother.
I mean, you're making it sound as if that's wrong. It sounds pretty right to me. What's wrong with that?
I think elective egg freezing sends women a message of, okay, don't worry, we have a solution for you. Delay motherhood. It will cost you thousands of dollars. It does involve medical risks. There's a good chance it won't work at the end, and if it does work, your pregnancy will be riskier for you and for your baby, but that's okay, we have a solution.
A better solution, she argues, would be to have policies like paid parental leave, flexible hours, childcare at the workplace to make it easier for women to have babies younger.
Who's dating?
But these women told us they weren't ready to have children younger.
still active and trying to find the right person.
And say they understand there's never certainty.
How do they explain that it's not a guarantee?
They said exactly those words. It is not a guarantee.
So what are the chances of success if you freeze your eggs? A 2022 study from one large fertility center found that 70% of women who froze at least 20 eggs before the age of 38 had a baby. But success rates dropped off considerably the older women were, and the fewer eggs they froze. Which means that many women, like Carissa and Namitha, do more than one round of egg freezing to bank more eggs. And that brings us back to the money. Business is booming in the field of fertility, and egg freezing is a big part of it. Companies target women with catchy ads on social media, host fun events like fitness classes, even a manicure, to give women information and draw them in.
What I've seen is a transition in my own field.
Dr. Marcel Cedars, a fertility specialist with the University of California, San Francisco, and a past president of the American Society for Reproductive Medicine, says getting women information is great, but she worries that the emphasis on profits she's seeing in private equity-backed fertility companies is creating warped incentives.
Have you heard in any companies that are owned by large firms that the doctors are being pressured to encourage more cycles, encourage things that will lead to more revenue?
I would hope it's not universal, but that is definitely occurring in some companies. How quickly do you get someone? How many cycles do you get per patient? That's how revenue is based. That's how payment and compensation is based. And so that's what the motivation becomes.
It becomes much more a business.
It does. I mean, I have always bristled when I hear my specialty called an industry. And I think in the past, it wasn't. But I do think it is becoming that. And it is painful to me. Pink, number 14.
She also worries about the unfairness when lower-income women and those who don't work for large companies can't afford egg freezing. Vardit Ravitsky agrees.
The majority of women who freeze their eggs electively are white and well-resourced, and there's a significant gap in your options and your reproductive autonomy if you have resources or you don't.
Everyone cannot do this.
Right.
Poor women.
I think we have a lot of work to do as a field. We don't yet know how to properly drive down the cost. It's a very expensive endeavor.
If this is being done just for someone's peace of mind,
right?
Should they go through this?
I think it depends on their age and attitude towards family building. If someone says to me, I'm 35, I know I want children, then yes, I think they should absolutely do this. Especially if they say, I want to have more than one child. Because, you know, they might be ready at 37, 38 and have no trouble at all. But when are they going to be ready for baby number 2?
Stars.
Speaking of baby number 2, Tina gave birth to a second little boy, Christopher's baby brother, Theo, in July, from the final embryo from her frozen eggs.
See the cars?
Egg freezing technology, Northwell's Dr. Singer thinks, will get better and better.
Do you think that one day, virtually every young woman will do this as it would be routine?
I really do think so. Once it's going to be affordable, covered by insurance, I'm a big believer that egg freezing and IVF is going to be the way our next generation will expand. I think that having timed intercourse or unprotected intercourse for reproduction is going to be falling out of favor in the next generation or so.
Wait. What?
Yeah.
What did you just say?
I said that sex is going to be for fun and for pleasure, but most likely in a generation from now, when couples want to have kids, most likely they're going to be using artificial reproductive technique. You'll have frozen eggs.
Wait, are you saying that we won't have sex to have children?
I'm sure my 2-year-old will ask me, Mom, Dad, you had unprotected intercourse? What about chromosomal abnormalities, miscarriages, twins? What were you doing? Russian roulette.
Dr. Singer thinks in the future all women will freeze their eggs so that the only reason to have sex is for fun.
He would say that.
While they didn't seem entirely convinced of that, they are definitely with him on egg freezing and the need for more education.
Should gynecologists talk about this when you go in and you're young?
Yes.
Absolutely.
Yeah. Yes.
I wonder why they don't.
I think our health classes were always, this is how you don't get pregnant. And I think opening the conversation to, this is how your body works. This is, at what age you might want to consider this if you want a family. Knowledge is just power in this circumstance.
If a woman goes to her gynecologist, do you think that doctor should introduce the subject?
I think it's a good idea. I do. It's a very sensitive topic, so you have to kind of navigate it carefully. You don't want to be judgmental. Not everyone has to freeze their eggs. Not everyone has to have children. But everyone should take the moment to consider their options and really think about what they want.
After the Supreme Court overturned Roe v. Wade in 2022, 20 states banned or severely restricted abortion. 6 states voted to protect access to it. And since we first reported this story last November, voters in 6 additional states have passed measures to amend their state constitutions to protect abortion. To understand the impact of the changing legal landscape and its complexities, we went to the first state to change its abortion laws, Texas. Tonight, you will hear from doctors who say in Texas, the laws designed to stop abortions are creating unintended consequences, hurting women with desired pregnancies and the people who care for them.
My mom is a doctor, and she is probably the coolest person I've ever met. And I grew up, with her coming home in her white coat, and I honestly just wanted to be my mom.
In 2021, Danny Matheson was following in her mother's footsteps, on her way to becoming an OBGYN. She was 25 years old, in her final year of medical school in Texas, married to her high school sweetheart, and ready to start a family.
We planned it out perfectly. I was going to get pregnant at this time, and it was going to be great.
You had it planned.
I had it planned down to the week.
Matheson was thrilled when she learned she was pregnant. Early scans and testing showed a healthy baby girl, but a routine fetal anatomy scan at 20 weeks did not go according to plan. What did they tell you was wrong?
Her brain was not formed correctly. She only had 1 kidney. Her spine was so bent that it put pressure on her heart. It was honestly a blur. I either said, is it bad or is it lethal? Her answer was, it's lethal. Meaning my daughter that I planned out to a T, and we'd already started to get little outfits and bath toys, was going to die.
What did you do?
Screamed, cried, got a second opinion, got a third opinion, and it wasn't a question as to what we were going to do. It was a question of how we were going to do it without getting arrested.
A motion to concur.
That's because just 2 weeks earlier, a new Texas law went into effect known as SB 8, Senate Bill 8.
And this bill says we'll protect that life when that heart beats detected.
The law banned abortion at 6 weeks with no provisions for victims of rape, incest, or severe fetal abnormalities, like Danny's case.
The motion is adopted.
The law also included a novel enforcement method deputizing citizens to sue people for aiding or abetting an abortion and rewarding successful lawsuits with a $10,000 bounty. The bill included an exception for medical emergencies, but didn't define what those were. Matheson says her doctor seemed scared and confused.
It wasn't clear what counted as aiding and abetting somebody getting an abortion. So they couldn't even counsel me and say, yes, we recommend you have an abortion or at least look into it, even if you go to another state.
So Matheson and her husband turned to her mother, the physician, for help. Several calls later, her mom secured an appointment for her to end her pregnancy at a clinic in neighboring New Mexico, a non-banned state.
She put her license on the line for that because I'm her baby and that's what I needed. She booked our plane ticket, she booked our hotel, and gave us an envelope of cash.
And you were afraid to use a credit card or have your name attached to anything?
Yeah, we paid for the abortion in cash so that there wasn't a paper trail of our Texas credit cards paying for an abortion.
A year after SB 8 went into effect and Roe was overturned, Texas enacted another, more restrictive law, banning all abortion from conception except when the mother's life was in immediate danger. In 2023, Danny Matheson joined 19 women with similar stories in a lawsuit against the Texas government for denial of care.
It is the first lawsuit in which individual women have sued a state.
The lawsuit did not seek to overturn the bans, rather to clarify which exceptions were allowed under the law.
I was in septic shock.
The Texas Supreme Court ultimately rejected their case.
Mr. Speaker,
But after the women filed their lawsuit, Texas legislators quietly passed a new law to include 2 exceptions to the ban. One for ectopic pregnancies, when a pregnancy occurs outside the uterus, the other when a woman's water breaks prematurely. But according to the Cleveland Clinic, those instances only make up 5% of all pregnancies.
The inconsistencies, the misunderstanding, the confusion, this is why women will lose their lives because of these rules.
Dr. Emily Briggs practices family medicine in Central Texas.
Hey there.
Good morning.
Good morning.
Her office is papered with the photos of some of the babies she's delivered over the last 15 years. She's overseen hundreds of complicated pregnancies.
5 years ago, I could counsel a patient on all the various treatment options available in these medically complex situations. And now it is a dangerous situation for me to have that comprehensive conversation with my patients.
Dangerous because?
Because I personally, as a family physician, could face losing my license. I could face life in prison. I could face huge fines just for having a conversation with my patient about evidence-based care.
So far, that hasn't happened. No physician has been prosecuted for violating the ban, which is a felony in Texas.
How does the office look today?
But Dr. Briggs says the threat of prosecution has created such fear that today it's not unusual for hospitals to require physicians to consult with staff attorneys when treating complicated pregnancies, even miscarriages.
This is not the medical care that those of us in medicine signed up for. This is not what our plan was or is when talking to a patient about their care. It should be between me and the patient. There's so much guilt when you lose a pregnancy. So add to that the slap in the face of having the risk department of the hospital come in and be involved in that conversation between you and your physician. And it's because of the legal ramifications from our legislature.
When there was a sense of urgency, like we need to deal with this right now.
Yes.
How do you proceed in this moment?
With great caution. In these situations, time is of the essence. She could lose her uterus. She could lose her life because of these situations. And when we have our hands tied and can't act appropriately at the medically appropriate time, we can have worsened outcomes.
Texas has only released maternal death data through 2021. But according to CDC numbers, after Texas restricted abortion, maternal deaths rose 61% from 2019, compared to 8% nationwide. Dr. Emily Briggs says physicians can no longer offer comprehensive maternity care to women in Texas.
Have you heard from colleagues who say, I don't want to practice medicine in Texas anymore?
Yes, definitely. Obstetricians, family physicians, yes.
In 2023, the number of OB/GYN resident applicants in Texas dropped 16%.
What does that say to you?
That says to me that future obstetricians are acknowledging the complexity of the rules in Texas. So not only do they not want to train here, but that also means that they won't want to practice here.
So we have a patient ready.
Adrienne Smith, who was a resident in Texas, transferred to the University of New Mexico Hospital last year. She told us one of her last cases in Texas still haunts her. A young woman who became extremely ill after she tried to end her own pregnancy with an unknown medication she bought in Mexico. Smith spoke to a supervising physician about the case.
I remember being like, I wish that there was something more I could do for her. And he looked at me and said, the Attorney General is looking to make an example out of somebody, and you don't want to be that case. And that was when I realized that there are people that are looking to criminalize me for that and send me to jail.
Dr. Eve Espy is the chair of the OBGYN department at the University of New Mexico.
What is it that a resident can learn here in New Mexico that they can't learn in Texas?
I mean, so many things. They lack an opportunity to learn trauma-informed care, diagnosing pregnancy complications in the first trimester and in the second trimester. They miss learning miscarriage care, ectopic pregnancy care, pregnancy of unknown location. I mean, the list goes on and on.
Those seem like pretty important things to know how to do.
Really important things.
Those things are part of the training required to become a certified OBGYN anywhere in the U.S. But here's the problem. In Texas, some training is no longer offered because of the new laws. That means OBGYN residents now have to leave the state for 2 to 4 week rotations to get the required training.
Is that long enough to really learn the lessons of all these various things you've just described?
No, it's not enough time. I mean, our residents have a dedicated rotation in the first year, in the fourth year, but they are working alongside of us throughout their 4 years of residency.
And Dr. Espy says her hospital isn't just absorbing more residents. Data shows more than 34,000 Texas women traveled out of state for care in 2023.
We've seen an enormous increase in our out-of-state patient volume. Just in calendar year 2023 compared to 2019, we saw an over 300% increase.
300%?
Over a 300% increase. And we, on any given day in 2023, 71% of our patients were from Texas.
Today, women making that journey face even more risks. 8 Texas counties have imposed travel bans, which threaten legal action against anyone helping to transport women out of state for abortion services. This past fall, Texas Attorney General Ken Paxton filed a lawsuit trying to gain access to the medical records of women leaving the state for that care. We reached out to Paxton's office multiple times over several months to ask about the issue and got no response.
So many of the patients who come to us that we diagnose with a miscarriage, they're like, I'm done with Texas. I want my care here. I can't trust my own doctor to take care of me for a miscarriage or a pregnancy complication.
What's the culture here?
Danny Matheson was one of them. After the loss of her baby in Texas, she and her husband moved to Hawaii to begin her OBGYN residency and start a family.
I did not want to be pregnant in Texas. Absolutely not. I think I know too much about what can go wrong in a pregnancy to feel comfortable being pregnant in Texas.
In January 2024, the Mathesons welcomed Emerson, a healthy baby girl.
One of the other things that
Dr. Emily Briggs is urging Texas lawmakers to work with doctors.
We are not looking at this from a partisan standpoint. We're not saying we're enemies. What we need to look at this as is we can all come together to make this safer for women in Texas just by making some changes to these rules.
If nothing changes, then what?
We lose physicians in Texas. We lose healthy mothers. We lose families in general. It's already scary to decide to become pregnant. Throw on top of that if something medically complex happened, you could lose your life and not have the care that you deserve. Why would anybody stay for that?
Since we first reported this story in 2024, there's been a small victory for doctors like Emily Briggs. In May, the Texas legislature passed a bill specifying that a mother's death does not need to be imminent for a doctor to be able to perform an abortion. Clarity that is welcomed, but for many Texan women and doctors, still doesn't go far enough. The United States is in the middle of a maternal health crisis. Today, a woman in the U.S. is twice as likely to die from pregnancy complications than her mother was a generation ago. Statistics from the World Health Organization show the United States has one of the highest rates of maternal death in the developed world. Women in the U.S. are 10 or more times likely to die from pregnancy-related causes than mothers in Poland, Spain, or Norway. As we first reported this past April, some of the worst statistics come out of the South, in places like Louisiana, where deep pockets of poverty, healthcare deserts, and racial biases have long put mothers at risk. Tonight, you will hear from some of the women trying to improve maternal health care in Louisiana, and why they say last summer's abortion ban set off a domino effect, making a bad situation worse.
The state of maternal health in the United States is abysmal, and Louisiana is the highest maternal mortality in the U.S. So in the developed world, Louisiana has the worst outcomes for women having babies.
Good morning.
As an OB/GYN, Louisiana's former state secretary of health and founder of Nest, a primary health service for families, Dr. Rebecca Gee spent a career advocating for better maternal care. Renowned for its rich culture and legendary celebrations, Louisiana also holds the distinction of being one of the riskiest places in the country to give birth. 39 out of every 100,000 mothers in Louisiana die during or shortly after childbirth.
How did we get here? Why is Louisiana in this position?
The high C-section rates have contributed, the lack of access to well-woman care before and after pregnancies. 50% of the time, women don't get that postpartum care, which means they have untreated hypertension, untreated diabetes, untreated depression, the fact that we have racial bias in healthcare. And so all of these things are compounded, especially worse for low-income women.
As Louisiana's Secretary of Health, Dr. Gee helped expand postpartum Medicaid coverage and push the state to track how race impacted care and maternal outcomes.
Was it underreported?
Absolutely. In the prior administration, when I was medical director, we were told we were not allowed to show data that showed health disparities.
Because why?
Because the political establishment didn't want to admit that there were disparities.
A state board now reviews and reports every maternal death in Louisiana. Dr. Gee worked with that board and found the results especially upsetting. Data showed 80% of maternal deaths in the state were potentially preventable.
You've looked at this as a doctor, as a policymaker. What needs to be done?
We have to prioritize motherhood, right? As a country, we have, and particularly in the Deep South, said that we're pro-birth. If we're really going to be pro-birth, we need to be pro-motherhood and pro-family, right?
What does that look like?
Making sure that women have time off to get their medical appointments, making sure that we have affordable child care, making sure that women have access to well-woman care.
Did you both grow up here?
Access is a big hurdle for many women in Louisiana.
So what's it like to raise a family here? A struggle.
28-year-old Teresa Dubois and 32-year-old Brittany Cavalier are both married and mothers of two.
Thank you.
They're expecting their third babies this summer.
Who's gonna win? Me.
Brittany runs the local daycare that Teresa's younger daughter attends. They live in Assumption Parish, a rural county of 21,000, where sugar cane is plentiful and doctors are scarce.
So to give us a sense of kind of where we are, how close is the nearest pediatrician?
Almost 45 minutes.
OB/GYN?
An hour and 35 minutes.
When you have to go to the OB/GYN and it takes you an hour and a half.
Oh, it's a nightmare. It's a lot. It's a lot emotionally. It's a lot in the car. It's a lot on your body just waiting that long to get help.
A third of Louisiana parishes are maternal health deserts, meaning they don't have a single OB/GYN, leaving more than 51,000 women in the state without easy access to care and 3 times more likely to die of pregnancy-related causes. The only hospital in Assumption isn't equipped to deliver babies, so Cavalier and Dubois have to travel more than an hour to get to hospitals in Baton Rouge to give birth, a harrowing journey when there's an emergency.
I mean, we are supposed to be one of the best countries in the world, and you just leaving the women out there to dry.
Starting with the most marginalized.
Latona Giwa saw those disparities when she worked as a delivery room nurse. In 2011, she co-founded the New Orleans-based Birthmark Doula Collective.
Hey, Trinity, how are you?
Doulas provide emotional and physical support before, during, and after childbirth. Last year, the collective worked with 2,000 mothers.
We work with the most marginalized families who are most at risk for poor birth outcomes. And we prioritize working with Black and Brown families, with low-income families.
In Louisiana, Black women are up to 4 times more likely than white women to die during or after childbirth.
What do you see in your line of work that Black and brown women are facing when they're pregnant versus a white woman?
We live in a country that does not guarantee insurance coverage and health care to everyone. There is different and discriminatory care. Black and brown people are more likely to be on Medicaid. They're going to practices that are busier, that take more patients. And that's where the doula comes in.
So you have your baby laying.
Studies show better birth outcomes for Black women who've had doula care.
There you go. Good job.
Birthmark's work in Louisiana caught the attention of Every Mother Counts.
How are you?
The maternal advocacy group founded by model Christy Turlington after she suffered complications with the birth of her daughter in 2003.
I hemorrhaged. There was a lot of blood. There was a whole sort of stream of things that needed to happen.
Really scary.
Scary and painful. But it was when I got home and really started to think, what about everyone else in the world that this happens to but doesn't have that team of care working together, understanding what's happening and actively managing it?
Those questions led Turlington around the world to document the challenges women face giving birth. Stories of midwives in Haiti and mothers in Baton Rouge.
How do you compare U.S. maternal health care to maternal health care in the rest of the world?
Well, the U.S. is one of 8 countries that have actually had an increase in maternal mortality. So we're certainly at the bottom rung.
Last year, Every Mother Counts distributed more than $1 million to groups focused on strengthening maternal care in the U.S., a mission that became even more difficult last summer. After Roe v. Wade was overturned by the Supreme Court in June, Louisiana implemented a sweeping abortion ban. The ban set off a domino effect across the state, impacting women like Caitlin Joshua, a community organizer. Joshua and her husband were thrilled to learn she was pregnant last summer. The couple have a 4-year-old daughter and were looking forward to expanding their family.
We started experiencing cramping. I've, lost a lot of blood.
She told us she went to Women's Hospital in Baton Rouge, where they did an ultrasound, examined, and monitored her. Joshua says that's where the treatment ended.
And so I said, okay, so is this a miscarriage? And the young lady, she said, I can't really tell you that right now. I don't know. And I said, well, what do you mean you don't know? We did the ultrasound. I recall her saying, we're just sending you home with prayers. We're going to hope for the best.
So you're in pain.
Mm-hmm.
You think you're miscarrying, and they say we're going to send you home with prayers?
Yes. We're Christians too. We pray, but it just was very insulting in the moment just because women come there for answers. So it would have been nice to get a definite response.
Women's Hospital told 60 Minutes it's complex. When diagnoses of early pregnancy loss is unclear, the standard of care is to wait. The next day, Caitlin Joshua told us her pain became unbearable, so she sought care from a second hospital, Baton Rouge General, where a doctor ordered another ultrasound.
She straight up said, this doesn't look like a baby at all. Are you sure you were ever pregnant? This just looks like a cyst.
Wait, she questioned whether you were pregnant or not?
Absolutely. And they discharged me maybe within an hour and a half or so after monitoring me. And on the paperwork, it literally said potential miscarriage or possible miscarriage, but nothing definite.
Knowing what you know now about what your body was going through, could you have died?
When I finally did get care from a midwife on day 5, she said that you certainly could have died. She said the amount of blood you lost, the amount of fluids that you were passing was a lot for someone in such a short period of time.
Why do you think there was such ferocious pushback from not one, but 2 hospitals?
I just have to believe that it is just the vagueness of the abortion ban in this state that's caused so much fear around physicians doing their job.
We reached out to Baton Rouge General. They told us every patient is different and that since the ban, they have not changed the way they manage miscarriages or the options available to treat them. The hospital left Joshua with one option: to take Tylenol and monitor for worsening symptoms. In Louisiana, some physicians are now afraid to offer methods typically used to treat miscarriages because those same methods are used in abortion and could be seen as illegal, potentially landing healthcare providers in jail.
To be clear, you were not seeking abortion. You were trying to have a healthy baby. You needed care, and nobody would touch you.
Absolutely. I think a lot of times we fail to realize the intersectionality between maternal health care, reproductive justice, and abortion care. Until we understand that all of those things interconnect, we probably will not see change anytime soon.
We take an oath to do no harm, and that's really our North Star as a physician. But when the prospect of doing that might cause you to be brought up on criminal charges, that's a really difficult place for our physicians to be.
You know, what's drastic.
Dr. Jennifer Avegno has been an ER doctor for 22 years and is the current director of the New Orleans Health Department. Last summer, Attorney General Jeff Landry sent a letter to doctors about the new abortion ban that Avegno says paralyzed maternal health care across the state.
The letter was something that I've never seen before as a practicing physician, a non-medical layperson inserting themselves into medical care. And there was a direct line about any physician who violates this will lose their liberty and medical license. And so really it was a threat.
What kind of criminal penalties does a doctor face?
At least 1 year and up to 10 years of imprisonment with hard labor.
This is about going to jail.
This is about going to jail. Doctors don't want to be in a war with their own state. They want to be able to just practice.
As the New Orleans Health Department director, Dr. Avegno has seen how doctors are struggling to interpret the language of Louisiana's new abortion ban.
What they're being told is, well, you can consult with the hospital attorney. But I don't know of any other disease or process where routinely you're being told, we'll get the hospital attorney involved. That also brings up what if the attorney advises something that the physician really feels is harmful. So really what our physicians are facing is a terrible choice to make decisions that might not be in the best interest of the patient or risk going to jail.
We reached out to 3 urban hospitals, rural hospitals, providers, and they said, we'd love to talk to you, but we're afraid.
Yes, that has been the consistent echo from providers. There's several providers, I think, that would love to speak out, but we're told by their hospitals that it's too risky.
So why are you sitting here today?
I am concerned that we are going to see a worsening of our morbidity and mortality rates simply because of access and simply because of fear.